being new dads, right? We can empathize with these guys, right? Like everything's off. Like anybody who tells you that they had a kid and things are all just fine and dandy is lying to you, right? Like you have to deal with your wife's hormones. Your kid is not sleeping through the night. Your sleep is disrupted now. Cortisol's off. You still have work stuff to deal with. You still have to be a man of the house, provide. So things are off. So what percentage of guys typically come to you even thinking the hormonal shifts is a problem?
A lot more now. I think there's a lot more awareness of low T and the effects of testosterone. You know, we can back up and say, well, what is testosterone used for? It's a hormone, a lot, right? Our muscle mass, where we distribute body fat. There are metabolic effects of testosterone, so blood sugars, blood lipids.
What are some of the things that are stigmatized when it comes to new dads? Like, what can they do in this high stress environment of lack of sleep? Their cortisol's through the roof, testosterone's declined 10 to 15% post having a baby. Like you said, it's all about communication and talking about your issues and being more vulnerable. And as a society, I think we're moving in that direction. It's going to be a bit more, it's going to be a little longer before it's more commonly accepted. But what can a guy who just had a kid do to cope with these things?
Yeah, absolutely. So the first thing is realizing that it's okay to ask for help, right? It's okay to seek out resources. And then there are so many tools that we have in our toolbox, right? If you need to lose some weight, we have tools for that.
Yeah.
If your testosterone has dropped and you feel like crud, which I see a lot of guys, that happens. And not all of them are overweight or obese. Some of them are, you know, they're eating well, they're exercising, they're doing everything right. You know, we've looked at all the reversible causes and their testosterone's still low.
Yeah.
You know, there's therapies that we have for that. And it doesn't have to be testosterone replacement therapy. There are other things that we can use to naturally, not naturally, but to increase testosterone levels that the body making its own testosterone, right?
Yeah. So increasing your endogenous production, right? Without getting external testosterone in, which is what's commonly known as testosterone replacement therapy, not going to testosterone directly because it has its negative effects. But what are those things you can use, or those tools, as you call them, medications-wise, that are you commonly use in your practice or you've seen used in Nimbus that help these guys?
Two of the big ones that I like to use are clomiphene or Clomid and HCG, human chorionic gonadotropin. I tend to prefer HCG over clomiphene because it's so in pharmacology, you have to look at how close are you to the root cause of the problem, right? So in general, as I've gotten older in my approach to pharmacology, I like things that are furthest or not that far from the step that I want them to do, right? It's like kind of what are those Rube Goldberg machines or whatever they're called, where like you drop the thing in and it goes through all these different wonky pathways to get to the destination. Well, why can't I just go directly
direct pathway,
to the direct pathway? So agents that are direct pathway, I'm very interested in that because there's less variability, in my opinion, between like genetics or environment or anything like that, right? So I've used both. It just depends on, you know, there's slight differences in adverse effect profiles. One's oral, one's injectable, right? It's subcutaneous, which is easier for people to do than I am.
When you still want to have kids and spermatogenesis or having the ability to actually produce viable sperm longer because you want to have kids, then those are the two tools you would typically use.